So because we are part of McCaig, chances are many of us may have torn our anterior cruciate ligament or our ACL, or like me, you haven't, but all of a sudden you know a lot of people who have and you're around it all the time. So now it is your new biggest fear every weekend when you go skiing. Because although Lindsey Vonn was able to ski just 9 days after tearing her ACL, for many people this is not the case. For many people, an ACL injury is not a short-term setback where you're able to return to sport a couple days or weeks later, but the beginning of long-term joint degeneration. 87% of people who tear their ACL will go on to develop post-traumatic osteoarthritis later in life, which is a painful and debilitating joint disease. And for many people, these are young, active, healthy individuals who are now at risk for suddenly significantly reduced mobility and increased risk of developing osteoarthritis. And although we know that the risk of developing osteoarthritis is very high, we still don't fully understand the progression of disease and what is happening in the joint over time, which makes it very difficult to provide interventions and treatments. So we can perform ACL reconstructive surgeries, and these are great for restoring the stability and function of the knee. However, they still do not prevent the progression of osteoarthritis. Additionally, during ACL reconstruction, we have to drill surgical tunnels in the femur and the tibia, which are creating areas of localized bone loss unrelated to bone loss caused from injury or disease itself, which is complicating the assessment of bone mineral density. And many current analysis techniques do not separate out the two. So this is the aim of my project. I am aiming to isolate and distinguish between surgically induced bone loss and injury-related bone loss by developing an automated segmentation method which identifies and excludes the surgical tunnels from the whole bone segmentations of the femur and tibia, so that the new segmentations with the tunnels excluded can be used in the longitudinal analysis of bone mineral density. By isolating these areas of surgically induced bone loss, we will be able to better understand how the rest of the bone is truly changing and adapting over time, and the role that surgery is playing in this bone change. ACL injuries are one of the highest risk factors for developing post-traumatic osteoarthritis, and having a better understanding of when and where these bone changes are occurring and the role that surgery is playing, we will be able to provide better interventions and treatments for these patients, hopefully preserving long-term mobility and delaying the progression of disease. And who knows, maybe one day we will all feel completely comfortable skiing 9 days after completely tearing our ACL. Thank you.
Any questions for Sasha?
I was wondering what kind of images you're using.
Yes, we're using dual energy CT images taken from a retrospective study. All the images have already been collected. Yeah, Arnie?
Sorry, so in this, this is, I think, the first time I've heard this. In this surgery to heal the ACL, we're sticking a tube from our femur into our tibia.
Yeah, so they have to drill a tunnel through the femur and tibia to pull like the new ligament graft through to restabilize the knee.
Okay.
So yeah.
And does that go through our cartilage?
No, it's like through the bone.
Okay.
Yeah.
All right.
Are there any lifestyle factors that interplay with this? Like, is like a portion of the bone loss due to lack of use and mobility following injury, or?
I definitely think that plays a role, because for a lot of people immediately after, like sudden stop of activity, and a lot of them can't move to the same extent that they were able to before. Mm-hmm. So I think it's definitely like a compounding factor, but I think there's a lot at play. So yeah.
All right, let's give Sasha a hand.